Welcome to our Mirror Healthy channel. I hope you will find this lesson helpful. Please like and subscribe for more lessons like this one. Danger signs during pregnancy or urgent maternal warning signs. If any of the following signs occur, the woman should be taken immediately to the hospital or health center. 1. Vaginal bleeding or fluid leaking during pregnancy. Vaginal bleeding during the first trimester 0 to 12 weeks, for any of the following reasons. Ectopic pregnancy, this is when the pregnancy develops outside the womb. Miscarriage, sometimes bleeding in pregnancy may mean a loss of a pregnancy. Molar pregnancy, this is a rare condition where your pregnancy does not develop normally from the very beginning. Cervical changes, these can lead to bleeding, particularly after sex. Vaginal infection. Vaginal bleeding in the second 13 to 26 weeks and third trimesters 26 to 40 week. It might bleed for any of the following reasons. Late miscarriage, this is the term used to describe the loss of a pregnancy between 12 and 23 weeks. Cervix or neck of the womb infection or inflammation. Placenta previa, this is where placenta is lying low in womb and covering some or all of cervix or the neck of womb. Placental abruption, this is dangerous as the placenta starts to come away, and may be accompanied by tummy pain. Vaginal bleeding later in pregnancy can be a sign of going into labor, known as a show. If pregnancy week is less than 37 weeks, this might also be a sign of premature labor. 2. Severe swelling, sudden or gradually worsening swelling in face, around eyes and hands. This can happen at any time during pregnancy or up to 6 weeks after birth, and it could be a sign of high blood pressure or preeclampsia. This is a condition that needs to be monitored as soon as possible. 3. Severe nausea and vomiting. Nausea and vomiting of pregnancy often develops by 5 to 6 weeks of gestation. Symptoms usually peak around 9 weeks and improve by 16 to 18 weeks of gestation. Persistent nausea will incapacitate the patient, and persistent vomiting may result in the loss of fluid and hydrochloric acid, leading to dehydration, alkalosis, reduced food intake, malnutrition, and anemia. To prevent this complication, eat small, frequent meals of plain foods that are high in carbohydrate and low in fat, such as bread, rice, crackers and pasta. Drink plenty of fluids, such as water. Sipping them little and often may help prevent vomiting. 4. Headache that won't go away or gets worse over time. Headache during pregnancy can happen for the following reason. Surging hormone, medical conditions related to hormonal changes like morning sickness, drops in blood sugar, increased blood volume and circulation, stress, lack of sleep, dehydration, caffeine withdrawal, changes in posture, particularly as uterus grows. Sometimes it can be related to blood pressure problems in pregnancy. 5. Fever during pregnancy or body temperature higher than 38 degrees Celsius. It's usually a sign of infection, example, urinary tract infection, listeriosis, fifth disease, measles, cold, flu and others not listed here. 6. Change in baby's movements. A reduction or change in baby's movements could be a warning sign that your baby is unwell. Your baby does not have enough fluid around them. There is a risk of you having a stillbirth. Other common warning signs during pregnancy are trouble breathing, dizziness or fainting, thoughts about harming yourself or your baby, chest pain or fast beating heart, and changes in your vision. This list is not meant to cover every symptom you might have. If you feel like something just isn't right, or you aren't sure if it's serious, talk to your healthcare provider. Thank you for watching.